Okay, so ultraviolet radiation, it's electromagnetic radiation that is in wavelengths from 400 to less than 290 nanometers. So shorter wavelengths, longer frequency than visible light. Basically, UV radiation lies between X-rays and visible light. So there are really three different classifications. Let's look at them, shall we? Really, I don't expect you to know very much about UV radiation except just indications, contraindications, and precautions. UV radiation has been traditionally used in wound care and dermatology settings. If you are a PT or a PTA working in a wound care setting, you might use UV light. Otherwise, you are probably not going to be using it in a traditional PT setting. So there are three bands, basically, UVA, UVB, and UVC, based on the wavelength. Longer wavelength is lower frequency and deeper penetration. So UV is between X-ray and visible light. So when we look at our spectrum, UVA is the longer wavelength, deeper penetration. UVC is the shorter wavelength, less penetration. And it's between X-rays and visible light on the spectrum. So the depth that the UV penetrates the skin is affected by the intensity of the radiation reaching the skin. The wavelength and the power of the radiation source, the size of the area being treated, the thickness and pigmentation of the skin, and the duration of treatment. The penetration is deepest for UV radiation with the highest intensity and the longest wavelength. So UVA penetrates the farthest and reaches through several millimeters of the skin. So really, the intensity is highest with a high-power lamp positioned close to the patient, with the radiation being perpendicular to the skin surface. Okay? So the effects of UV radiation include skin erythema, which is redness, tanning, epidermal hyperplasia, which is increased production of skin cells, and vitamin D synthesis. It can also be, UVC particularly, can also be bactericidal. So the erythema production is primarily from UVB and UVA with sensitization. So they talk about PUVA, which is psoralen, which is a sensitizing chemical that's applied to the skin before exposure to UVA. So the psoralen plus UVA is called PUVA. Tanning is the delayed pigmentation of the skin that occurs in response to UV exposure. And it just, the UV exposure causes increased melanin production. Vitamin D synthesis, this is a chart from the book. It's just kind of neat that the sun and UV light produces vitamin D. I don't expect you to know the details of this, certainly. But usually the epidermal hyperplasia is the thickening of superficial layer of skin. It happens about 72 hours after exposure to UV and increases with repeated exposure. So all of these things are things that you see when you get exposed to natural UV sources, otherwise known as the sun. Of course, if you live in Western Washington, you probably don't get to see the sun all that much in the wintertime. And so most adults in Western Washington probably need to take a vitamin D supplement. Talk to your doctor about that. So the indications for UV radiation, one of the primary things that it's been used for in the past is psoriasis. There are medications that treat psoriasis that are excuse me, widely available. treatment of psoriasis with UV light is generally not done in a PT setting. It's usually done in a dermatology setting. So the proposed mechanisms for psoriasis is it inactivates cell division, and psoriasis is where you get excessive cell division and you get these plaques of skin cells built up on the skin. It inhibits, UV radiation inhibits DNA synthesis, and it inhibits mitosis of those hyperproliferating epidermal cells. It's also used for other dermatological conditions, but of course we don't do that in PT. UVC is most commonly used to avoid erythema or tanning in wound healing settings, and again, unless you're a PT or PTA working in a wound healing clinic, you are probably not going to see this. The proposed mechanisms for wound healing are increased epithelial cell turnover, accelerated granulation tissue formation, bactericidal effects, and promotion of sloughing of necrotic tissue. So, not a ton of research to support the use of UV for wound healing, although it is used. Contraindications, direct radiation of eyes. It's another one where you have to wear goggles. Skin cancer, you don't want to make it worse. Pulmonary disease, cardiac, kidney, and liver disease. SLE is a contraindication, lupus, and having a fever. Precautions, if someone is photosensitive or is taking photosensitizing medications or supplements. Recent X-ray therapy, and they don't really want to repeat UV until the effects of the previous dose have disappeared. So if you got tanning or skin reddening, you want to wait until that's completely gone before you do another treatment with UV. In the book, they talk about the method they use for figuring out the dosage of UV, and you will not be responsible for knowing that. Potential adverse effects are burns, like sunburn. You need to carefully assess the minimal erythemal dose prior to treatment. That's what I was just talking about. You won't be responsible for that. Premature aging of skin is an adverse effect. Carcinogenesis is an adverse effect, and eye damage is an adverse effect.